So for a while, I've kind of been obsessed with this idea of a different approach to tracking medical issues, trying to find the causes of problems and trying to identify things early in a way that isn't necessarily being done by the current healthcare system, and not some kind of voodoo thing. I know there's a bit of a stigma that if you're doing something alongside or differently from the healthcare system, then it must be something in conflict with it, but that's not how I see it. I've just had this thing rattling around my brain for ages to do with pattern recognition. By extension, machine learning and AI, but kind of. That will be useful for it. The reason I'm interested in this field is because if you know a little bit about me, I keep bumping into all sorts of different issues, and it keeps happening. And some of these issues are very subjective in the way that, well, they're objectively real, but the symptoms present as something subjective, which means that the doctors you see don't have your symptoms on a list of signs, clinical signs, and because of that, they don't know how to treat, or they don't know what to do, or they don't know how to help. That is a limitation of the current education level of the healthcare system. It's not that your symptoms aren't real, and it's not that they're not coming from very real sources in the body. It's that the policies and procedures that have been written for diagnosing the issues are inadequate and inferior and undereducated, under-researched, etc. And it's weird because the assumption that the healthcare system knows all is, I think, a ludicrously stupid one, in the way that obviously new medical conditions will appear over time. And that's because human evolution and genetic mutation doesn't stop just because we start looking at it, especially in combination with the fact that we are designing, developing, distributing new compounds in food, in products, and that the general composition of our environment is changing over the years. Those are already two massive factors that will cause change. So there are a lot of us now, and we're a very intermingling species. So the variety of genetic mutation is going through the roof. Then we've got the compositional change going on. Then we've got new medical advances like vaccines and stuff. And then on top of that, we've got the whole other world surrounding our current planet of transmittable diseases. So bacteria, viruses, parasites, etc., coronavirus being one of them, or a category of them. So the point is, new things are always going to happen. So it always annoys me when you walk into a situation with a doctor where they say, well, I've never heard a patient describe something like you before, therefore I think you're wrong. And I have had that recently with my eye issue, a scratch causing nerve damage, causing neuralgia, which led to a whole series of odd symptoms that when I described them to a professor at one of the leading eye hospitals in the world, in London, I won't say it by name, just to cover my back a bit, but when I described it to him, he said, I've seen a lot of patients and none of them have described pain like you do. It's very arrogant, very stuck up, I know all. So I felt very dejected and lost after that, naturally. I left feedback to the hospital and I never heard back from them. I decided to change my approach and then find someone at the same hospital, at the same level, but someone with a different personality, with more of a researcher background. I found them, I connected, I got seen by them, and they immediately had a different conclusion because they had been exposed to more patients with strange pain without stain symptoms, which typically come from nerve damage or neuralgia or neuropathy, which tends to happen quite a lot with diabetic patients, of which I'm not yet. Mine was just triggered by an acute injury. And I asked him, he also thinks it's connected to the fact that I've had a lot of trigeminal pain with this nerve from dental issues in the past, which may have sensitized it in some way. And he also went ahead and asked me whether I had a background with migraine in particular. And I said, I do. And he said that's a commonality he's seen between patients that report similar things. So the point there is that the feeling that I think some professionals have of I'm right because I've never been exposed to what you're describing is, I think, the death of a lot of patients. Like genuinely, for a couple of days during the early days of this particular issue, I was what I would describe as borderline suicidal, which is something that I don't want to just throw around loosely, but it is a very common thing for people that have corneal neuralgic and neuropathic issues. But thankfully, it's largely under control now. The researcher put me on steroids, and I made some changes to encourage nerve regrowth, and that has kicked out a whole ton of symptoms that I was having. So that is just one particular issue where the symptoms are largely subjective, so they're hard for someone to see when they just observe you. Another issue I had in the past was in 2020, I was having sensory breathing issues. Now, obviously, you think of 2020, you think of COVID, you think, okay, everyone was having breathing issues because it was an objective attack on the lungs. But I came away randomly that year with an inability to feel air in my lungs. And I had no idea what was going on. I felt like I was suffocating for months. It was awful. Then I was having hyperventilation symptoms, even though I wasn't hyperventilating. Because when you don't have the sense that there's air in your lungs, you don't even realize that you're trying to take in deeper breaths. And it's not an anxiety thing. We had to, filter out everything like like that. I had my lung function assessed as well, x-rays, etc., anemia checks. Everything was perfectly fine. So you end up with a situation where you're having something that is very real for you, but that isn't seen on regular clinical signs. And something that's really interesting, by the way, the only objective evidence that I could find, going back, and I will skip ahead because I do know what caused it, but we'll get to that. Looking back on my blood results during that phase, they looked fine within reason because I've got some blood condition issues. But one of my issues is lymphocytopenia, which means I have a low white cell count. So my baseline is a below range white cell count. But during that period of investigation, my white cell counts had risen to be within the average range for an average person. Now, for a doctor that comes in and tackles this issue, they'll look at that result and go, that's normal. You look fine. Your results are fine. It's only now looking back on it, I realized that's not normal because my baseline, and even since then, in now more recent blood tests, is below average. That spike into the normal range is evidence of something wrong. But obviously, if you're coming in without the context of before and after, you will look at it and think that's normal. Now, if you don't know, the white cell count can spike during an infection. And I had wondered whether I had COVID, which had caused this kind of sensory issue. But at that point, I had no evidence that I had COVID. In fact, all the tests I'd done said I hadn't. I didn't have any, cold or flu-like symptoms. But just the fact that during that period, when I was having these breathing issues, that a sudden white cell spike had occurred that lasted for a couple of months, by the way, because it was shown in 2 major blood tests over that period. That's an indication that something must have happened to me. Anyway, that ended up being a new intolerance to milk protein, not lactose intolerance, some kind of reaction that happens in the esophagus, where if I have milk protein and then a few hours later have something irritating like vinegar or alcohol or something minty, then I lose the ability to feel air in my lungs. It's some kind of like sensory inhibition thing. We still don't know exactly what caused it. My gastroenterologist at the time had never heard of anything like that. And our final conversation was we'll just have to put it down to a post-COVID symptom, but since you're doing fine now, there's not really much else we can do. So part of that experience was kind of fundamental in teaching me that a lot of stuff is going under the radar. It's not being studied. In an ideal situation, I would have thought that if we didn't know what this condition was, and if it's something brand new, then technically I should be studied and then added to the record of all medical knowledge. Over time, by the way, that reaction has settled down. I'm less intolerant to that protein. It's either casein or whey, but we're not too sure. I didn't really want to test it, but I've heard some theories from other people now that it's most likely casein, if that's how you pronounce it. I still do have a reaction if I have something, particularly if it's uncooked. So for example, butter that's not super processed and hasn't been put through a microwave with meal, if I have that, then that tends to spike it. So a good example of that would be if I'm buying like a sandwich from a shop that has butter on it, and I typically never have butter, but that cold butter will trigger the reaction more than something that's been put through an oven or a microwave, which is really interesting to me. So that situation taught me a lot about like elimination testing. Believe it or not, now kind of looking back, figuring out whether there's a dietary component to something is not easy, but it is simpler than figuring out the connections with other issues. My eye issue has proven to be much more complicated. There's still a lingering issue, and I'm just about starting to have physiological reactions alongside some of the symptoms, which didn't happen before, but I find that now really interesting because I have something to measure. I can look at the color of the tissue inside my inner eyelid and see which regions are more red than others and how that changes. Things start to look a bit more like allergic conjunctivitis. I can look at the redness of certain capillary in the tissue between the lacrimal carbuncle and the sclera, because there's a particular capillary that flares up when I'm having a lot of inner eye pain. So that makes that look not nerve related, which is great because that's something I actually had a theory about from the beginning, that a whole bunch of my symptoms were nerve related and other ones were just advantageous, like some kind of infection like blepharitis or Demodex, just taking advantage of the fact that I wasn't cleaning the eye as thoroughly as usual during the early stages of the injury. So I'm still kind of investigating that now. And then hopefully then once the burning is gone, then I would have knocked this long, like 7-8 month saga out of the park and I can wrap up the eye problem. But we're not there yet. And then also there's all the vestibular issues. And again, if you've ever kept track of my videos on that, I've learned so much about the vestibular system. And it's really something that I can't go to any doctors about now because practically no one understands it. Like, we've got doctors that are specialists in BPPV and inner ear otoconia detachment and reabsorption, and then how to interpret which canals otoconia are moving in. But then also, if you're talking about the vestibular nerve, then we've got specialists on the nerve. And then if we're talking about the neurology of adaptation, then we've got neurologists that are specialists specialized in that field, but it seems like very few people are specialists on the entire system. And again, I've mentioned in the past canal dehiscence, but that's more of an ENT field, but not really because it's an ENT neurology. So I've resolved to now training, in quotes, AI to help me with that successfully. So we can say what we want about large language models, right? But one thing I found is that they are somehow unbelievably excellent for solving vestibular issues with mechanical sources. Now, what I mean is we'll take BPPV as an example, benign paroxysmal positional vertigo. A doctor, like a vestibular specialist, may be trained in one specific policy, should we say, or policy list, a specifically dated flow chart or a guideline for diagnosing the issue. But when you have a patient with very specific modifications on an issue that present different symptoms, then that requires something that not only understands the literature and the policies that are pre-written, but also how to now modify that for a specific patient without rewriting the whole thing. And that is where large language models like ChatGPT are surprisingly excellent. They're practically superhuman for doing that. They have the total sum of all literature ingested into the dataset about things like BPPV and which canals are responsible for which kind of symptoms. And then I give it an explanation of my divergence from the traditional symptoms and why they occur, and then ask it to diagnose me. And I will go on this back and forth with it about when I turn my head this way, this happens to me instead. And I did this as a test to see whether it could adapt the diagnostic process and whether that would help me get out of episodes. The answer is yes, it can. Now, I've only done it with 3 episodes so far. That's how long I've been doing it for. And obviously, I've reduced my frequency of BPPV. So when they do happen, I enlist the use of my specific training prompt as a test. For the first episode, it solved it in, I'd say about, I think it was 5 or 6 maneuvers over the one specific session in an evening. So I did it. I still felt weird. I went to bed, woke up, and I was fine. Now, we could say that, okay, maybe during the sleep, the crystals moved into a new position. But what I will say in response to that is that it had been going on for about 4 or 5 days prior. So for me, the maneuvers were a turning point. The second time, it didn't help, but this time ended in a particularly strong vestibular migraine. But for this particular episode, I believe it may be in a slightly more complex situation. You see, there could be a type of BPPV called capulolithiasis, where crystals are adhered to the cupula in the inner ear, which is slightly harder to deal with because traditional maneuvers may not solve it. But I believe this was why it ended in a vestibular migraine, because vestibular migraines for me tend to occur when there's a large kick of the inner ear, which deviates from expectation too far. And I think with capulolithiasis, this is more likely to occur than canalithiasis, because when the crystal detaches from where its position is on the cupula, that causes more of a signal kick than just a crystal moving around in the inner ear. So I believe that's what happened in that episode. But then episode 3 was a incredible success. I woke up in the middle of the night. I had very obvious positional responses. Again, no nystagmus, but my eye drifting. So like when I looked down, it would drift right. When I look up, it would drift left. It might not be in that specific combination, but it was very much like, whoa, okay, this is very positional now. So that was the perfect opportunity to test it. And I believe we did it in about 3 or 4 maneuvers. The eye drift had stopped. There's still a bit of residual disequilibrium, if you want to describe it that way. When I woke up in the morning after falling asleep again, perfectly fine. And that was amazing to me, because in the middle of the night, that was such a strong positional response. I thought, oh, this is going to last for days. It's going to last for days. I'm going to end on a migraine again. It's going to be awful. But I told myself to persist and follow what ChatGPT was advising. And it would effectively go, okay, start off by laying down, turn your head right, what happens? Turn your head left, what happens? Describe that to me. Okay, now we'll move on to something more advanced. Okay, we'll do a barbecue roll maneuver. For every position, tell me what your eyes are doing. And then I would report that back. And then it would say, okay, from the sounds of it, your right ear is affected. It's the horizontal canal. So we're going to do this. And then we moved on that way. Now, given the obvious success of episode 3, the clear success to me of episode 1, and only intermittent success with episode 2, because what happens is when you're in the middle of an episode like that, when you do a maneuver, for me, it tends to make me feel better for a while, even if the crystal isn't fully repositioned. So it may come back in the way that it just falls back down to a bad position. My conclusion is that using a large language model to try and give advice for treating these episodes is far, far better than not using it at all. It's something that I need to continue testing when I have future episodes, which may happen soon because I'm doubling up my caffeine today, and that's another trigger for mine. So with that primer out of the way, we're going to talk about a project that I've wanted to work on. It requires quite a lot of prep before we get to it. So my theory is that if you take as many data samples of a system as you can, so the system in this case would be a body, and then without looking for something specific, so without actually looking for a condition, you just look at the sum of all data in the set, like a pattern, like noise. And then over time, you learn what's regular. And then when you see deviations in the noise, then you know that something is wrong. So this is something you might see more in like meteorology, weather systems, or I don't know, any machine learning type detection system. You look at a noisy image of what a system is, you build up a tolerance because you kind of understand what's normal, and then you detect a deviation. I feel like every single human being should be tracked this way. And when I say tracked, I don't mean by the government. I mean, we're actually kind of getting there with like our smartwatches and phones and stuff. But if we're wearing something that is itself, with concern to privacy, tracking 1 million data points in the body, and it follows you as you grow up, it understands what's regular, and then it detects a deviation that in our modern day may very well go under the radar. And the deviation may be something like, okay, the nitrite value in urine, which is a sign of urinary tract infection, or a better example may be the protein level in urine, which may be an example of kidney failure. That is something that if this device was just tracking all the data points we can possibly think of, you look at the total noise and the urine protein value is just spiking in the noise somewhere. Now, kidney failure may occur over a very long amount of time. Someone may, with this system, detect it like 20, 30 years in advance of it causing an actual problem, depending on how sensitive these data points are. I think the problem nowadays is that we are not detecting things properly. We have to go through this long bureaucratic process after something has gotten so far that we can actually tell it's a problem in our day-to-day life. That is far too late. And then after it's become an obvious problem, you have to go through this process of waiting, seeing a GP that may not even understand what's going on, because as we know, things are getting more complex, and then go through this long list of trying to see a specialist or being put on a waiting list. And all of this is more time for something to kill you. And I just think this is so ridiculous that if we had personal trackers that are trying to auto-detect divergences, we would discover things so many years in advance, and it would relieve so much weight off of the healthcare system. Now, I've just messaged a dermatologist today because I've got like a mole I want to get checked and removed. Maybe it's cancerous, maybe it's not, but I don't know. Maybe I would know already if we had a system that was tracking, and if I would see, okay, this is a concern, but all of the thousands or millions of data points show that nothing else is happening, then I'd be able to make a more educated decision, say, okay, I don't think this is cancerous because there's nothing else occurring, so I will take the weight of the healthcare system by not getting that checked, or maybe I do want to get that checked. But then as soon as other values start malfunctioning, even if it's something that's not apparent in our day-to-day life, but it's just in the data, I'll say, okay, we're starting to see a slight deviation in another data point, so now I think this is a good time to get checked. So the problem is, to build a system like that, we need to API the detection process. So what I mean by APIing the detection process is I have experience with writing APIs for software, right? Easy BPY for Blender is probably the best use case of that. It's where you can take something complicated, like a complicated sequence of actions, and then condense it down into a simple function. So imagine that you want to calculate when a cloud is going to be over an area. That may include a long list of mathematical formulas based on data that you've got, and that's a large amount of time. But you could condense it down into a simple function, which is time, cloud location, and then pass one parameter, which is just the location that you're trying to gauge a measurement from. So take a really complicated process and turn it into a simple function, and that's called abstraction. And as we're taking different layers of complexity and making them simpler and simpler, these are ascending layers of abstraction. So my theory was, how do we do this for healthcare? Because the process of obtaining data is a sequence of complicated events. And in many ways, we have abstracted very simple pieces of data like blood pressure. Now, the function, the API process for doing this, is me sitting here with this device, wrapping it around, pressing a button, and it giving me the systolic, diastolic, and pulse information. And that is data I can put into a detection system. But to make the detection system more effective, we need to simplify that process even further. The way we do this is by automating it. So that's one thing to think about. If I was to line up every piece of data I want to work with, I would look at each of them and think, how do I make this faster? I need to design a tool to do that and report the data back. How do I make that smaller? How do I make that more efficient? And I am interested in doing stuff like that. So the next thing is blood. Blood has so much information. It can tell the story of the whole body depending on what we're looking at. Now, the problem for me is that I have a fear. I have a fear of pricking my fingers. So I got a whole lot of lances in all different forms, with all different mechanisms of action, and I started trying to get over my fear. Because even without other points of data, reading data from blood as much as you can, so we've got like total cholesterol in front of me, I've got blood glucose, hemoglobin, uric acid, and then there are other like one-shot tests you can do. Things like antibody tests for H. pylori, we've got ferritin, vitamin D, all sorts, and I think people are manufacturing new tests all the time. If we do each of these every single day, so you're getting data, and obviously it's going to cost money because these things aren't as affordable, so that's another goal goal that someone should have a tackle at in the long term is how do we make data point testing more affordable? And again, idealistically for a single device. Even just these data points, you could probably detect some aggressive cancers earlier than they would manifest elsewhere. Because when you would look at a graph of each of those data points over time, layered over the top of each other, you would see when there's deviations in the pattern. But still, these are quite surface level data points. You want to get more specific. Like I can do total cholesterol from here, but I can't do LDL or HDL. I have to send off for that, which is still okay, but it requires a bit more blood, so the process is a bit more inefficient. But I also think these are very obvious objective things, but it doesn't really matter what the data points are, so long as they're varied from each other. So for example, I think, and this may be a bit of an extreme example, you might be able to tell whether someone has cancer by measuring the temperature between their toes and the color of their hair and the pH level of their sweat in a specific area of their body. I'm just using that as an example because if you took these hyper-specific samples that are different from each other in different areas over a long period of time, if there's a deviation from a regular pattern, then it also indicates there's a problem. And even if it's not cancer, for example, it may be an indication of a different type of disease or something dietary affecting them, affecting the output of their sweat, the composition, some kind of deficiency affecting the hair, that kind of thing. Anemia for like the temperature and other overlapping factors like that. Now, if you could tell something was wrong just from comparing three very different data points, and then imagine what happens if you then do that for everything. So the temperature on every part of the body and inside different areas of the body, the pH or other values of liquid, any measurement we can take from any excretion all over the body, spectrographic information all over. When you reach a certain threshold of data points, even if you don't know exactly what the data points are, you're just looking for deviations between irregularity, then you would be able to detect when anything goes wrong, even without specifically noticing or understanding what it is. So in theory, you could have a detector that tells you that you're going to have an issue before it manifests as an actual problem, without even knowing what the problem is or specifically what you're measuring, just so long as the data points are established as things which are different enough from each other. Now, obviously, that's just theory. Applying it is a massive engineering problem. And also for functionally analyzing that kind of data, you need a way of ingesting it, storing it. And that is something I've been thinking about quite a lot recently, because again, with all of my issues, I have this interesting compulsion to note everything down, which is kind of handy, but I didn't really know what I would do with it. Like maybe I would pass that on to researchers at some point in the future, just keep it for posterity, make it public, etc. Even though there may need to be some pruning down with some personal information in there. But the format that I've been noting all of my issues down is kind of inefficient at the moment because it's just like a textual log. Ideally, it would be in a very refined and number-centric data format, but condensing real-life experience down into that is, I think, ineffective in the way that there's a lot lost in there. And even just the frequency of complaints made in a textual report is itself data that may be lost when trying to convert it down into regular objective data points, especially if we're trying to force them into the context of something very medical and pre-known. And again, AI could be another use case for this, where we could have an LLM read through textual logs and then extract some data into a specific format, CSV, JSON, whatever, and then use that for analyses. And yes, we can say the accuracy may be an issue, but we can run the same check using multiple different LLMs. And then on top of that, then have analyses to double check that the data is valid. You could have like 50 layers of different LLMs or different AI systems checking the validity of each other. And sure, maybe they'll be wrong. But if we're taking a machine learning approach to looking at a sequence of 1,000 or 1,000,000 data points, one slight deviation, so the inaccuracy of a single value, isn't really going to matter depending on how we're adjusting our sensitivity and looking for deviations. So even if there's inaccurate data sporadically, it won't really matter. We don't have to set a sensitivity for one slight off value in the same way that for space travel, a single flipped transistor shouldn't stop the entire mission if a cosmic ray hits it. Same principle here. So we can have safeguards to like double, triple, quadruple check the information in parallel. The point is that if there's a trend of multiple data points causing a deviation, then we know something is probably wrong. And I rather optimistically think that solving this, basically bringing detection to the human individual, like a device to track 1,000,000 data points about their body to tell when something is going wrong or when something will go wrong in advance. I think this is the solution to relieving the healthcare system, particularly here in the UK. But the problem is this requires a lot of ingenuity, a lot of theory as well, because I'm talking about APIing the system, taking really complex operations to get a single piece of data, thinking about about it in terms of the data point and how do we simplify that down into a new layer of abstraction. And a lot of people don't think this way, specifically like consultants in the healthcare system. They have a specific line of work. They've grown accustomed to it over years, decades. They walk into a room, they speak to a patient, they say the same things over and over again. They hear the same things over and over again. And there's a particular policy that they have to follow. And they're not thinking about optimizing the process. This is how they make money. Patient walks in, walks out, they get money. Ideally, for working with this kind of project, we need to have people that want to make the process more efficient. So it would have to be the kind of consultant that sees a patient or sees multiple patients that say the same thing and then thinks to themselves, I need to optimize this process. Rather than letting more patients walk in, I need to minimize the time patients are here. I need to prevent them from getting here in the first place. I need to condense all of this to maximize the number of people getting treatment. But that's not how the system's built, because it's working around people that are paid to have jobs. Then people aren't going to work to make themselves redundant. So this kind of project requires people that are working to make themselves redundant, which is exactly why it's probably not going to come from within the healthcare system. Or maybe it will. Or maybe it'll come from a governmental level, because I think, again, particularly here in the UK, we're starting to learn that the NHS is woefully inefficient, particularly when it comes to bureaucracy, paper, etc. And that's causing problems. And we started to see some digitization with 2020, COVID, etc., which is a bit of a kick to the system to try and modernize a bit, but it's definitely not enough. Early detection doesn't rely on people going to a GP and waiting for an appointment. It starts at home. And again, like I said, it should be privacy centric. It should come in the form of a device that should be distributed to everyone, that tracks, that detects. And I think really investment should be put heavily into picking up more data points from home. So right now we have to send so much stuff off to labs to be analyzed and come back, and the labs are tightly packed away behind specific processes. A doctor has to fill out a form. A sample has to be collected by a specific place. The sample has to be in a specific pot provided specifically by the GP or the doctor. It's such a behind closed doors process. We need to optimize the detection process and move the lab to the home. Now, obviously, I can't do that. I'm just a stupid YouTuber working from home. But what I can do is optimize what I have control over. So one of the projects I wanted to work on was look at all of the possible things I can detect from home, understanding that hopefully more will be made more accessible over time, and API this within my own environment. So I can log data down into a spreadsheet type format. It's taken me a long time trying to think about a good format that will be appropriate for data analysis in combination with my more linguistic logging, and then try and optimize the system here and condense the space physically. So like literally sitting here, okay, let's do bloods, blood detect, write the values down, move on, let's do pressure detect, write the values down, do urinalysis, maybe not right here, but write the values down, so that this becomes the sample detecting space. All the data is acquired into one particular spot, a cloud spreadsheet should we say, and then we can run data analyses on this. So in that kind of theory, the device that I'm imagining is this, the space. And I have a name for it. I'm going to call it Project Allflow. I'm saying that now. I probably will never do anything bigger with it, but although it looks like there's a company called Allflow Dispense Limited and Allflow Pumps and Pump Systems, but that kind of makes sense for like the flow of water. But it can just be my personal code name for the project. So the meaning behind the term for me is Allflow. All data points flowing in one direction and maybe necessarily in the opposite direction for kind of hallucinating pattern recognition for what the next values should be in a data set. So that's when it comes to interpreting what the data should look like in the future, what it should have looked like in the past. So all flow is basically just data points, no matter what they are, whether we know what they represent for the body or not, moving back and forth. Acquisition and analysis. And maybe nothing will come of this project. I've got a lot of work to do. First of all, I mean, I've still got to get over my fear of blood pricking. I already found a way around that, but it requires help from someone else. To keep it short, I still cannot get over, I think I must have something inbuilt primal about pricking the fingers, something that says just don't break the skin there. But I found the best place for me to do it is on my back. The space between the spine and the shoulder blade, the soft tissue there, when I get someone else to do it, I don't feel anything and I have no qualm about it. It's really weird. It's like a psychological thing. So I want to try and find a way to make that easier as well that doesn't require someone else. I mean, I might be able to do it myself, but then I need to set up a system for that, system of mirrors, and maybe, I'll think about it. But that's the thing as well, maybe even something I can design, a device that I can put on my back that acquires a drop that I bring forward. The drop is ready to use to analyze in this micro lab type environment. Or maybe I can get better at doing painless ways elsewhere forward fronting in the body. I know that pricking the hand and around the fingers is something that a lot of people do, and they say that the side is painless, but I don't want to do that. I don't want to ruin my skin. I'm committed to finding the most psychologically frictionless ways of doing things as possible, and really this is of no concern to me. So that's like another API process. Obtain drop. So drop can be used for other processes. It's kind of like automation games or logistics games. Like I'm playing Satisfactory, it's a video game at the moment. It takes a little while to get to the process where you can use coal, but once you've got the infrastructure set up to utilize the coal, then really it opens the way for so many things. A blood drop is one of those things. If you can get one without going through the actions of the process or going through the psychological friction of that, then that one drop opens the way to so many things, so much analysis. And I've got a microscope back there. I could learn to use that as part of this process as well. But anyway, that's something to think about over time. Hopefully I live long enough and I maintain enough kind of stable work from home with the main channel and all that to actually do work on this on the side. But who knows? I just thought I'd share some of these ideas. So if you made it this far, thanks for watching, and let me know if you did in the comments. You're welcome to support me if you want to in any way you see fit. I've got a bunch of products. You can sign up to the Patreon, subscribe, etc., or just share your thoughts. Right now, I am working on the data formatting for ingesting information. I have years worth of data stored away in written logs. And I also have like blood test data and all sorts of other test data, stool tests, urine test, MRI, whatever, stored away that can be ingested into this new format. So maybe that's something I'll do over time as well. I'll sit down and then put this in. But yeah, I should probably go and work on some other stuff as well. So thanks for watching, everyone. Stay safe, and I will see you next time.